The Johns Hopkins University School of Medicine study reveals what the medical profession has long realized. Deaths by medical mistakes are way underreported.
A lot of times when these errors do occur, there aren't systems in places for these hospitals and health systems to counteract them or to bring them to public light.
Dr. Shabrat Sahu, Chief of Internal Medicine at Hackensack UMC, says he's not surprised at the study's results. Hopkins researchers say medical errors have been unintentionally excluded from national health statistics based on a nearly 70-year-old method of classifying deaths. So they examined studies and crunched the numbers. They measured their findings against the leading causes of death in the U.S. and concluded medical errors at 251,000 in 2013 actually are the third leading cause of death, surpassing respiratory diseases. Study author Dr. Martin McCary.
We were surprised by the scale.
Dr. McCary says the medical profession doesn't learn from its mistakes the way the aviation industry does after a crash, when hearings and findings are public. Instead, medical malpractice lawsuits can get settled in secrecy with confidentiality agreements that prohibit the parties from talking about them.
And that's part of the problem, I believe, in patient safety, is that we have created this wall of silence where we don't talk openly and honestly about the problems.
Attorney Drew Britcher has handled hundreds of medical malpractice claims in New Jersey. He also was instrumental in the state enacting the Patient Safety Act. The law requires hospitals to report serious, preventable adverse events and an analysis of how to fix them to the state health department. Britcher says he's confident hospitals are following parts of the law, revealing some teachable lessons for the profession. But he says evidence shows too often hospitals are omitting important treatment information from patients' charts.
I think it's because of the fact that they anticipate that no one's going to notice that part because the Department of Health isn't looking for that part.
And not notifying the patients, your thoughts on that?
Well, I think that that's a travesty, that the law was designed so that they can report to the patient or the patient's next of kin or the patient's healthcare representative what has transpired, and it can't be used against them in a litigation, so why wouldn't you do it?
We approach safety from the team approach. Safety and quality is our #1 priority for our patients.
Hackensack UMC just got its 9th straight A from the national nonprofit Leapfrog Group, which has graded hospitals twice a year since 2012 on preventable medical errors, injuries, accidents, and infections. However, a Google search shows Hackensack UMC has both won and lost lawsuits for medical mistakes that led to death and permanent disability over the last decade or so. But Dr. Sahu says the medical center has earned its high marks by practicing safety from the ER to the OR to the most routine visit.
If you don't have an appropriate system in place and a team in place, you may have potential avenues for error, but not here. Here we are looking at all our processes through each service line. And if there is, by the small chance, an error that occurs, we evaluate each one individually with a significant root cause analysis, making sure there's proper next steps, education for our entire staff.
To help prevent medical mistakes, the medical malpractice attorney has some suggestions for patients.
Ask questions and get answers.
Other suggestions: research a doctor's credentials and medical malpractice history. Ask your primary doctor about specialty doctors. And question new procedures and devices, because as the medical malpractice attorney says, there's a learning curve on everything. In Newark, Michael Hill, NJTV News.